thank you all for joining us again for another week of our Facebook Live series. Just to start off with, a big shout out to our sponsor MaxiPass for providing us with the support and resources that they do provide us, that we can run these videos for you guys. So I'd like to introduce you guys to our guest for this evening. We're very lucky to have Dr. Luke Mooney, orthopaedic surgeon based out of Wakefield Orthopaedic Clinic at Calvary, Adelaide. He also does some work regionally, so in the Riverland, Naracoorte and Mount Gambier. And also in his free time, he is a SASMA council member. So thank you very much for joining us tonight.
Thank you. Thanks for having us.
Perfect. So tonight, what I thought we would do is have a bit of a chat about knee injuries. Obviously, being an orthopaedic surgeon, you do cover a lot of knee injuries. So at the community level, you know, if someone does have a knee injury, does that automatically mean, you know, they're going to be put in to see an orthopaedic surgeon, they're going to be having surgery, that kind of thing?
No, the knee injuries are pretty common, as we know, and it can be a highly variable group of injuries. It could be from the mild to moderate to the severe. Knee injuries are pretty common, as we know, and it can
Sorry, be just got two lots of sound going here.
Highly variable injury.
Perfect. Sorry, my sound was just doubling up there, making sure we had sound.
No worries. So it can be a very mild injury, which may be just a minor twist and a sprain, or it may be a more serious injury to one of the structures inside the knee, such as the meniscus, or the worst, you know, the sportsman's worst nightmare or a sports player's worst nightmare, an ACL injury.
Yeah.
It could be anything. The idea is to firstly take a good understanding of how it happened and what made and what the signs are. So whether there's a lot of swelling or a lot of pain, and then make a bit of a decision about, you know, are we going down one line or the other? Do we need to see a sports doc, an orthopaedic surgeon, or start with physiotherapy?
Yeah, and so you mentioned ACLs. Obviously, we do hear about ACLs quite a lot. If you do have an ACL injury, does it automatically mean that surgery is required?
No, not everyone. There are a group of people that can injure their ACL and return to the same activities that they desire, but it would still take them a full ACL type rehabilitation with physiotherapy. The difficulty we have is predicting who is going to be successful in returning to those activities without surgery and who not. And so that's the biggest challenge for us. So a lot of those discussions are really had at the start, and it can be that you're really trying to understand whether there's some other factors in that person's situation or in their knee that makes them more likely to fail non-operative treatment. So from our point of view, trying to work out whether there's just an ACL injury or whether there's a combined injury with the MCL or the PCL or the lateral-collateral. There's a serious or significant meniscal injury. And also whether there's someone who generally has joint laxity or multiple injuries to that knee. I think those people are more likely to need surgery in their knee. Okay.
And obviously with ACLs, sometimes it can be just a fairly simple movement. And you see AFL players quite regularly. It's, they're just a change of direction or something similar like that. Why is that the case? Why does ACL not need to be traumatic kind of to
Yeah, we see it with bone. Just enough force applied to a bone or a joint with the right amount of torque can cause a catastrophic injury, either rupturing the ACL or causing a fracture to a bone. So it's often a perfect storm, a bit of a slip, bit of a hyperextension, bit of a twist, and enough load on the leg at the same time is enough to cause the ACL to rupture. And often it is, like you say, often it is reasonably dramatic. The person says, I felt a pop, and within a very short amount of time, I had a lot of swelling and pain. But occasionally we see people that someone else heard the pop, they didn't feel any pain, they kept playing, and it wasn't until the end of the match that they had noticed that their knee had swollen up and they weren't happy with their knee. So it can happen like that.
Yeah. So there's not any, telltale signs or symptoms that someone's done their ACL?
Well, the telltales are usually that immediate pain and swelling. That's probably the most common thing, and that sensation or an audible pop.
Okay.
That's the classic. But then it's the time frame for the swelling. So if someone injures their knee but they get no swelling in their knee, then it's very unlikely they've got internal derangement to the cartilage or to the ligaments. Mm-hmm. But if they twisted their knee, had pain, and they develop swelling very quickly, then it's highly likely they've had an ACL injury or something major happen inside the knee.
Okay. And is there any, risk factors that would make someone more susceptible for an ACL injury?
Yeah, so we know female gender has an increased risk of injury in the same sort of sports. Mm-hmm. Injuring your opposite knee, so having a previous ACL rupture makes it more likely to rupture the non-injured side.
Yeah.
And then generally, people have lax joints or excessive hyperextension where the knee can go beyond straight quite excessively. So in females, we accept about 5 or 10 degrees of beyond straight, whereas males tend to be up to 5 degrees. And if you're really able to extend the knee beyond that, you're probably more likely to do that during sporting activities and put too much tension on the cruciate ligaments. So they're probably the most likely things. And also the sporting activity you play. So if you're on grassy surface with studs and sprigs, we know that there is an influence of footwear on ACL rates.
Okay.
And influencing factor too.
And what about things like age? Can age be a factor, or as we get older, does the ACL get that bit weaker? Or
no, I don't think there's any real evidence for degeneration with the ACL apart from partial injuries or repetitive injuries.
Yeah.
If you've had a couple of injuries to the knee and that's affected the ACL, that can create weakness and minor laxity within the joint that makes it more likely for the ACL to be torn.
Yeah.
But usually if you're going to rupture the ACL, I think in that younger age group is more likely. Somewhere between 18 and 25 would be the highest rates when people are increasing the type of sports they're playing and higher velocity sports.
Okay.
They're more likely to injure it then. But if you make it through that early part of your career without an ACL injury, it becomes much less likely. You can recall people in AFL that have had an ACL injury at the end of their career, but that's probably less likely generally.
Yeah. Okay. So it's kind of potentially a bit of the kind of cross code different sporting things as well, where I guess, as you said, in that 18 to 25, where people are playing different sports and maybe picking up a new sport that they're not quite used to playing, and there's different movements.
Yeah, that's right. And also being outside in potentially slippery ground or uneven ground, I think that's when we see more injuries as well in general community sports.
Yeah, perfect. And obviously, probably 10 or so years ago, all we heard about was having Lars reconstructive surgery. Is that still how you hear of it anymore, or more going back to the kind of traditional methods?
Well, it's very infrequent we'd see people using Lars now. It was quite popular, like I said, 5 or 10 years ago, probably 10 years ago. Because it's a bit of a dream to be able to have an ACL reconstruction without taking a graft from anywhere else in the body, without the pain and swelling that you get from taking a graft. So it is, if you can make it work, it's great. But in orthopedics, we've had probably 4 or 5 iterations of Lars type synthetic grafts, and unfortunately all of them are, and they eventually create synovitis or inflammation in the knee, and that synthetic graft fails, and so we really don't use it much at all now. We might consider using it on the outside of the knee, but even that is really thought not to be a go-to up front.
Yeah. Okay. And you touched on it before with it being, I guess, a risk factor, but how important is rehab in something like an ACL injury to, prevent it happening again? Or, as you said, if it happens in one knee, you could potentially be, quite likely for it to happen in the other knee. So obviously rehab is really important.
Yeah, absolutely. From a surgery point of view, the surgery takes really about 90 minutes from tomorrow, but the overall recovery is a full 12 months is recommended. So the hard work is actually done between the person having the ACL and their physical therapist or physio. And it's a really stepwise rehabilitation. The times we see, the most common reason for failure is a return to sports before full rehabilitation has been done. And so the risk of re-rupture at 3 months after an ACL reconstruction is about 30%, which is very high. Whereas 12 months, it's really down to about 1% per year after that. So if you do all of your rehab, the chance of you having a re-rupture is much lower.
Yeah.
The big thing for return to sport is confidence, and that's what I speak to with my patients is just getting that confidence back in the knee and not really having to think about your knee and position it. Until you've got that, then you may not be ready to return. I think that's a big one to work through with physio.
Yeah, and I guess it kind of highlights, especially at the grassroots community clubs, the role of the sport is really important. So obviously keep encouraging those injured players who are coming back to, they are still part of the team and they can be involved. And, like you said, that importance of rehab and not just, initially post-surgery and then maybe month 11 when they know they want to come back at 12 months.
Yeah, definitely. Waiting their time and then seeking some formal testing to be sure that they're ready to go. And like you said, having confidence not only on the injured leg but also the uninjured leg. And really what we're going for, if you've injured one leg, we really want both legs to be 150% of normal rather than just getting back to normal. So really overdo the strength, the balance control, the dynamic control within the leg and the core, so you can protect your leg, practice your jumping and landing, twisting, pushing off.
Yeah.
Getting good confidence with those activities before getting back to sport.
Yeah, and like I said, that's where our sports trainers and first aiders can link in with their physios and really help those players come back and know that they are still part of the team and have that support system around.
In that time from 6 months onwards, when they're approaching their return to sport, they're working more closely with their trainers than that discussion backwards and forwards and making sure that everyone's happy that the knee's back where it should be.
Yeah. Perfect. And what about, there's obviously a lot of injury prevention programs out there. Obviously, the big ones are probably the FIFA 11 Plus, as well as, the netball knee program. I guess, how did they work and are they really, really beneficial for, players and clubs to try and implement to restrict or prevent ACL injuries?
Yeah, they've been great programs, haven't they? Just being part of the normal warm-up and the start of sessions for training and games, implementing them in that way, I think, has probably been the most helpful thing. But just taking at-risk knees, which is basically everyone who's doing cutting-type activities in their sport, through a set of exercises to gain strength, dynamic control, and balance through landing and taking off. And so there's really good evidence to say that reduces the rate of ACL injuries. And I think the most dramatic difference has been seen in the female gender in AFL, soccer, and probably netball to some degree as well. Yeah, so
if you are interested, obviously, at your community clubs, just try and start implementing these programs. Just do a Google search for them. They are there. They are really useful, really good videos and programs that you can implement to your training programs. We have had a question come through, and anyone watching, if you do have questions, please feel free to post them. So I've got a question from Kieran Richardson, who said, what do you think of the systematic review that shows ACL doesn't reduce the risk of secondary injuries compared to a high quality rehab program alone?
I just missed it. We just had some cutting out. I'm really sorry. Do you mind repeating that for me?
No worries. So what do you think of the ECHA's 2020 systematic review that shows ACLR doesn't reduce the risk of secondary injuries compared to a high quality rehab program alone?
I'd have to go through the paper itself, but the ACLR is about reducing moments of instability and allowing people to return back with a sense of confidence within their knee. So I'll take the question on notice, but to give you a more formal answer, I could do it afterwards. Certainly from it's a symptom control treatment strategy, the surgery itself. So it's not about stopping arthritis in the future. It's about assisting reduction in instability moments in the knee and allowing people to get back to those cutting activities. So a trial of therapy and strengthening may be appropriate for the majority of patients and people in the community if they're willing to go through that. And that's probably the hardest part of that discussion with the ACL injured player, is talking to them about ACL rehabilitation programs, the chance to have surgery, and the potential that if they did go through rehab, they might come back to needing the ACL recon down the track. So a lot of it is people coming into the rooms already with a treatment strategy in mind, and trying to talk to them about some of those preconceived thoughts that they have about ACL and its treatment. But I think there's building evidence for the non-operative rehabilitation of ACL injured knees. We just, like I said before, we're not sure who's going to be successful. There are some people who have red flags in their situation, but it's very hard to separate them all out into definitely being successful with that strategy.
Yeah, I guess it's really difficult, isn't it? Because ACLs are a really common injury, and especially on your tele sports like AFL, netball, even so. And so I guess you see the elite level, you see these players that go down, they have their ACL surgery, they do their rehabs at their elite clubs, things like that, and then 12 months if not before they're back playing. So I guess you do kind of have that idea of, well, that's what is going to happen for me, it's going to end up like that. So I guess, as you said, you kind of have to break down those preconceived ideas of well, just because that happened at the elite level doesn't necessarily mean it'll always be the case at more community grassroots level.
Yeah, we did see in previous randomized trials that return to elite sports was lower in the non-surgical group, and so that's probably part of that conversation with people. What are their current goals? What are their future goals? And are they definitely returning to those sports or not? And that's how I would shape that conversation, I think.
Yeah, perfect. Thanks for the curly question, Kieran. Kind of going back to the injury prevention programs, are they do they help in kind of your other type of knee injuries, your MCL, PCL, things like that, or are they really focused on the ACL?
No, they help with all. No matter which structure you're trying to protect, I mean, all those structures work together to give the knee its full function. And so the stability of the knees, the shape of the bones, the shape of the meniscus or the soft cartilage in the knee, and then the support with the cruciate and collateral. So the programming for building proprioception and strength is going to help the muscle side of balance, dynamic control, and proprioception. And that'll support the intra-articular structures of the knee. So that's really what we're trying to target is core and leg strength and balance control.
And you kind of briefly touched on it before, but I guess a lot of our, the recreational athletes, we do, you might have a knee injury and you go back to playing and you keep going, and I guess, is there a risk of arthritis and long-term damage if the rehab's not done properly? And as you said, there's a risk of injury, but are there kind of other long-term effects of, if someone does have ACL reconstructive surgery, are they going to go on to kind of other kind of problems later in life?
Certainly at risk of it, unfortunately. With the time when you rupture your ACL, you're twisting the knee enough to have the femoral condyle, which is the part at the end of the femur, at the end of the thigh bone, twisting off the back of the tibial plateau or the top of the shin bone, enough to be able to twist and rupture the ACL. And so what happens at the same time is that the two hard cartilage surfaces contact and cause contusion to the bone, or the bone bruising that we talk about, and we see that on MRI at the time of their scans. And that contusion is not just to the bony part, but also to the hard cartilage. So we know that if you have an ACL rupture, the risk of arthritis in the future is significantly increased. That thought that if you have a minor injury to the knee and then return to sports early, in some way you might end up with a worse injury without full rehabilitation and conditioning. So I think there is a cumulative effect of knee injuries, and in the same sort of way, meniscus inside the knee. If you unfortunately have an injury to the meniscus and have to have it trimmed to return to normal function, that meniscus does serve a function. So if you have it trimmed out or you injure it, then it's not able to perform its function. Then you're putting more stress on the hard cartilage in the knee, and again, there's that increased risk of degeneration within the joint. So I think there's a cumulative effect of knee injuries in terms of immediately without rehabilitation, but also long term in terms of resulting in a painful stiff knee with arthritis as well. Unfortunately.
Yeah, I think we kind of have those visions of people walking away from sport with just ice packs everywhere, both knees, that kind of thing.
Yeah. Hopefully, the ice packs are on the muscle tendon units of the leg rather than the joint parts, because muscle tendon units can recover a lot better than intra-articular or joint structures can.
Yeah.
So that would be more ideal.
Yeah. Perfect. Well, I don't have any more questions from my point of view. I think we've been able to cover quite a bit in terms of ACL injuries and the importance of rehab. Unless anyone else has any more questions, I guess if they do come through, we can always ask them of you a bit later on, Luke. But thank you very much for giving up some time and joining us tonight on our Facebook Live. We do really appreciate the time that you've put into this.
It's a pleasure. Thanks for having me.
Again, just another thank you to MaxiPass for their sponsorship and allowing us to run these Facebook Lives. Just a few plugs for upcoming events that we've got. There's still a couple of places left in our Allied Health Level 1 this weekend. So get online and register for that one. We have a professional masterclass next Wednesday with Dr. Duncan Walker, who is presenting on shoulder assessment techniques. And we also have a taping workshop coming up on the 8th of September, which is on lower limb taping. So thank you all for joining us again tonight, and we'll be back next week with another Facebook Live. Thanks, everyone.
Thanks, Steve.